Members, we are going to move to Senate Bill 75. Senate Bill 75. I'm sorry. Ms. Olson, you are recognized.
Thank you, Mr. Speaker. I request unanimous consent to suspend the rules to withdraw ACA 1 from the Budget Committee and have it taken up today without reference to file for the purposes of third reading.
That takes a second.
Ms. Olson moves. Mr. Mathis seconds.
Debatable.
This is not debatable. There's a motion to suspend the rules. This procedural, members, the clerk will open the roll. Ms. Olson is asking for an aye vote. Mr. Holden is asking for a no vote. Ms. Olson is asking for an aye vote. Mr. Holden is asking for a no vote. This requires 41 votes. The clerk will close the roll. Ayes 28, noes 52. Motion fails. Members, we are moving to Senate Bill 75. The clerk will read with amendments.
Senate Bill 75 with amendments by Assemblymember Chang.
Ms. Chang, you may open on the amendments.
I stand to offer amendments that will once and for all restore Medi-Cal provider rates. This budget is $7 billion more than last year's budget, which dwarfs the cost of Medi-Cal restoration. I know that the governor has called a special session on Medi-Cal rates, but quite frankly, it is completely unnecessary. Reversing the 10% provider cut is not an issue of enough funding. It's an issue of priorities. We can make this happen today. We don't need a special session to do it. The budget we are voting on is poised to expand Medi-Cal eligibility, so we are going to add more people into a program that isn't funded and isn't working. We're sending them into a system where 12.5 million Californians can't access a doctor today. It sounds nice to expand the universe of people who qualify for Medi-Cal, especially when we're talking about kids. But just because you hand someone a health insurance card doesn't mean they have access to health care. You know, it's amazing we have yet to make this a priority. California's Medi-Cal program has grown to cover half of the state's children, yet only 54% of physicians are accepting new Medi-Cal patients. Those numbers are staggering, disheartening, and unsustainable. These numbers illustrate the very real concern that Medi-Cal beneficiaries, including children, will not be able to find a healthcare provider unless payment rates are restored. If we restore Medi-Cal payment rates, we can expand the number of healthcare professionals who can provide much-needed healthcare. We can do this today. Members, we don't need a special session. We don't need to raise taxes. We just need to show Californians that this is important. And I respectfully ask for your support on these critical amendments.
Thank you, Ms. Chang. Mr. Holden.
Thank you, Mr. Speaker. I would move to lay the amendments on the table.
Mr. Holden's moving that we lay the amendments on the table. This requires a second. Ms. Garcia seconds to lay the amendments on the table. Members, this is not debatable. Requires a majority of those present and voting. This is procedural. The clerk will open the roll. Mr. Holden is asking for an aye vote. Ms. Olson is asking for a no vote. Mr. Holden is asking for an aye vote. Ms. Olson is asking for a no vote. Majority present and voting. Clerk will close the roll. Ayes 49, noes 27. The amendments are laid on the table. Moving to the bill in chief, we will take up Senate Bill 75. The clerk will read.
Senate Bill 75 by the Committee on Budget and Fiscal Review, an act relating to health, making an appropriation, therefore, to take effect immediately, bill related to the budget.
Dr. Weber, you may open.
Yes, Mr. Speaker and members, this is the omnibus health trailer bill that makes significant improvements to our health, our state's health care and public health infrastructure. Specifically, among the other many provisions this bill will also do is that it extends one full-scope Medi-Cal coverage to an estimated 200,000 uninsured children, regardless of their immigration status. It eliminates the 10% rate cut in Deni-Cal, It establishes new public health programs that include a pre-exposure prophylaxis demonstration program to promote drugs that prevent the spread of AIDS, a hepatitis C demonstration project to connect patients with quality health care in order to reduce transmission of hepatitis C, and a purchasing program for materials needed for a syringe exchange program. Finally, it provides new protections for nursing home residents by establishing deadlines for the department to complete investigations into nursing home complaints within 90 days for first 2 years and 60 days in 3 years. I respectfully ask for your aye vote.
Thank you, Dr. Weber. Seeing no discussion or debate on this item, the clerk will open the roll. All members vote who desire to vote. 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 The clerk will close the roll. Tally the vote. Ayes 52, noes 28. Measure passes. Members, we are going to move to Senate Bill 82. This is with amendments. The clerk will read with amendments.
Senate Bill 82 with amendments by Assemblymember Grove.
Ms. Grove, you may open on the amendments.
Thank you, Mr. Speaker. Signed by Governor Ronald Reagan, the Latterman Act vision is now threatened by neglect in the community service system that is being abused and not being funded, but yet we are wastefully spending on outdated institutions where developmentally disabled people are housed. This community organization for purchases of services where developmentally disabled people live in the community with us has not had a raise or an increase in almost 15 years. And the last one that was given to them was taken away and not yet restored. These amendments will allow the Latterman Coalition 10% funding to be inserted into this trailer bill under the Developmental Services Bill. It's shameful that we are using the developmentally disabled individuals as a pawn to raise taxes in a special session, and I hope that they recognize that. These amendments would make this a priority for this body and this legislative, everybody on the floor, to increase the 10% funding mechanism for the developmentally disabled in the community for purchases of services to make their lives fuller and better. And I'd request these amendments been added.
Thank you, Ms. Grove. Mr. Holden, you are recognized.
Thank you, Mr. Speaker. I would move to lay the amendments on the table.
Mr. Holden is moving that we lay the amendments on the table. This requires a second. Ms. Garcia seconds that we lay the amendments on the table. Members, this is procedural, not debatable. Majority of those present and voting. Clerk will open the roll. Mr. Holden is asking for an aye vote. Ms. Olson is asking for a no vote. Mr. Holden is asking for an aye vote. Ms. Olson is asking for a no vote. The clerk will close the roll. Ayes 51, noes 27. The amendments are laid on the table. Members, there are questions about the analyses on the amendments. They are on your desktop for your information. We are moving to the bill in chief. This is Senate Bill 82. Clerk will read.
Senate Bill 82 by the Committee on Budget and Fiscal Review, an act relating to developmental services, making appropriation therefore to take effect immediately, bill related to the budget.
Dr. Weber, you may open.
Yes, Mr. Speaker and members, this is the Developmental Services Trailer Bill, SB 82, that provides various changes to programs and services related to developmental services. Specifically, this bill specifies criterion that must be met in order for the Department of Developmental Services to move forward with a closure plan for developmental center, and includes a provision that provides consumer protection and increased stakeholder and county involvement. It also clarifies the legislature's intent to utilize general fund savings from the developmental center closures to provide enhancement for services in this community. It makes clarifications to the self-determination program to ensure that residents transitioning out of developmental centers have access to this program, and allows the Department of Finance to increase the number of participants in this program with approval of the Joint Legislative Budget Committee. It also caps the total amount of beds for the delayed egress and secured parameter facilities to 150 and requires a minimum of 50 beds be reserved for the incompetent to stand trial population. It also requires that no more than half of the facilities that house incompetent to stand trial residents be larger than 6 beds. It allows for the expansions of beds at Porterville Developmental Center and includes guidelines for the length of stay of residents of the Transitional Treatment Center. I respectfully ask for your aye vote for SB 82.
Seeing no members seeking recognition, Ms. Grove, you are recognized.
Thank you, Mr. Speaker. On this bill, the bill in chief, it would have been better with the amendments, but this bill does set a goal for the closure dates for the developmental communities, or excuse me, the developmental institutions that are run by the state. It also requires the DDS to submit a closure plan for one or more of the developmental centers to the legislature by October 2015. It does include intent language for the general fund savings that is derived from these archaic institutions in order to go to the community. I would rather have that intent language be actual language, because intent language never seems to go anywhere in this building, but it is moving the ball down the field at least a couple of yards to require intent language. So on the bill in chief, it would have been much better with the amendments to allow the Latterman Coalition to have their 10% in the community so the community is not starved, but the bill itself does move the ball forward just a little bit, so I would ask for an aye vote on this particular bill. Thank you.
Thank you, Ms. Grove. Mr. Lackey, you are recognized.
Yes, Chair and members, I'd like to stand and speak for a part of our population that has difficulty in doing both. As a former special education teacher, and members, I would appreciate a little attention, because I would say that this population is getting the same level of attention. And it's about time that we recognize that we have part of our population that is overlooked because they don't have advocacy groups that they can afford to pay to come and influence us to act in their behalf. It's disgraceful. I'm proud to be part of this body that does so many good things. But we're in crisis. The special needs people and the special needs community is clearly in crisis, and we are not giving them their due. I'm grateful that we're giving them this token recognition in this bill, but we got much more to do. Please at least support this.
Thank you, Mr. Lackey. Mr. Thurman, you are recognized.
Thank you, Mr. Speakers and members. I rise in support of SB 82. I just have to say, this Assembly took action on Monday to vote to increase the DDS rate to 10% over a 2-year period. I want there to be clarity and no confusion that many of the speakers who've spoken in opposition of this measure voted against the very thing that they're asking us to hold out to do. We voted in this House to provide 10% to all those agencies that serve people with developmental disabilities, and many who've spoken out against this very measure spoke against it and voted against it on Monday. I'd like to also clarify a few highlights about this bill. By voting for this bill, you'd be voting for millions of dollars to do intervention and screening for very young children who might have a developmental disability. And in voting against it, you'd be voting against that Early Start program. This bill also contains millions of dollars that will create new resources like housing and job training programs for individuals who will move out of developmental centers, out of state hospitals. We want them to be able to live into the community. This bill has millions of dollars to help create those resources, so those resources are ready when our consumers are moving into the community. We all know groups that have been not satisfied with not getting enough money in the budget for what they would like to have. But unlike some of those groups, those who are served in the developmental disability community have a chance to get to the rate increase, potentially at 10%, by being a part of this extraordinary special session that the governor has called. So I urge the members of this body to vote yes on SB 82, and then let's immediately begin our work to support those in the developmental disabilities community who will be served through that special session.
All debate. Mr. Bloom.
Thank you, Mr. Speaker. And just briefly, I want to echo the sentiments of my friend from the East Bay. This legislature, in our conference committee, very clearly spoke about what its priorities are. And I think we all know that there are members of this community who are paying very, very close attention to our words and our deeds. The governor didn't agree with us on amount, but the governor did agree with us that this is a priority. That's why there's going to be a special session. We will see how that turns out. But let's be clear about what the intentions of this legislature, of this body, of what the Assembly are. We're in agreement that this is a priority and is a priority that needs to be funded.
Thank you, Mr. Bloom. All debate having ceased, Dr. Weber, you may close.
Yes, Mr. Speaker and members, I appreciate all of the comments that have been made and obviously the concern and the passion that we have for the disability community that's here. Most of you know that last year I served as chair of Health and Human Services along with Mrs. Grove, and much of our passion and desire was to expand and to push the needle forward. This does that. We realize that we've been in a very deep hole when it comes to a host of communities, and this community is no exception to it. But we have continued to try to work to improve the conditions and the support and the resources that are there. And in our first budget, that level of support, which wasn't at the level we wanted, but it was higher than where it is now, we were able to do. We have not been able to obviously land an agreement at this point, but that does not mean that we are not committed to doing that all of us have expressed that. The extraordinary session will work on it. But there are many things in this bill that are laudable, that moves us forward, that states a commitment that we have to live up to in terms of how we're going to interact with this community and the services we're going to provide and the quality of life that we're going to develop for them. I respectfully ask for your aye vote for SB 82 as one of the many steps and the beginning steps as we move forward to do what's right by the disability communities.
Thank you, Dr. Weber. With that, the clerk will open the roll. All members vote who desire to vote. 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 The clerk will close the roll and tally the vote. Ayes 79, no 0. Measure passes. Members, we are moving to Senate Bill 80. Senate Bill 80. Clerk will read.
Senate Bill 80 by the Committee on Budget and Fiscal Review, an act relating to taxation, making an appropriation, therefore, to take effect immediately, bill related to the budget.
Dr. Weber.
Yes, Speaker and members, this trailer bill, SB 80, creates California's first earned income tax credit for taxable years beginning on and after January 1, 2015. This credit provides more income from the lowest income working families in the state. It establishes a refundable earned income tax credit to an eligible individual who is equal to the earned income tax credit allowed by federal law in an amount determined by the EITC adjustment factor as determined in the Budget Act, set at this year at 85%. It also requires the Franchise Tax Board to annually prepare a specified written report and provide it to the legislature to measure whether the EITC achieves its intended purpose. It includes intent language stating that in future years, it is the legislature's intent to expand EITC to benefit a broader section of the working poor Californians. I respectfully ask for your aye vote for SB 80.
Thank you, Dr. Weber. Mr. Stone, you are recognized.
Thank you, Mr. Speaker. Members, the Assembly this year has made it a priority to put some things in place to address poverty in California. We have the highest poverty rate in the nation, and an earned income tax credit is a proven tool that will move families and children out of poverty at a rate we have not seen before. California is starting to recover in many of our areas, but where our poorest families are not recovering, and our families who are in the bottom of the wage scale are not recovering, not enjoying the benefits of the recovery. Earned income tax credit is proven to move people out of poverty, increase educational outcomes for those families, increase social outcomes for those families in a very significant way. In this budget, however, what is missing is the other piece that the Assembly should be proud it pushed forward, and that is ending the maximum family grant rule in the CalWorks program. It is too bad we were not able to accomplish that this year. And I hope we will continue to have that conversation as we move forward, because if we're not paying attention to the poorest Californians in ways that help to move those families out of poverty, alleviate poverty in serious ways, then we are not responsible to the breadth of California. Earned income tax credit is a very powerful tool, a proven tool, and I respectfully request an aye vote.
Thank you, Mr. Stone. Mr. Daly, you are recognized.
Thank you, Mr. Speaker. I rise in support of this piece of legislation. I think it's a great bill. I want to just let you know that this is not going to end poverty, but it is a tool to allow working families to get further ahead so that hopefully at some point they will be able to make a better wage, a higher wage, and then be able to pay taxes at some point and help contribute to the system. So for those reasons, I stand and I applaud Mr. Stone for bringing this bill earlier, and I support this bill, and I urge my colleagues to vote for this bill.
Thank you, Mr. Daly. Mr. Wilk, you are recognized.
Thank you, Mr. Speaker. Members, I too stand in support of this bill. This concept was devised by Milton Friedman, and it was first implemented by President Ronald Reagan back in the 1980s. As my colleague from the state of Jefferson mentioned, this is a great tool for working families, and I'm glad to see that we're going to pass this on a bipartisan measure. Thank you.
Mr. Ridley Thomas, if you can compose yourself.
Yes.
You are recognized.
Yes, Mr. Speaker, thank you. I simply rise to affirm the gentleman from Santa Cruz in his long fight with the Ending Poverty in California caucus. It's a unique opportunity for us to really stand up for something that's a fundamental tenet of justice and for advancing opportunity, which is to help individuals climb out of poverty. Measures such as this that are a continuation of Great Society programs and the like, and the war on poverty that is we must fight like none other today because of the challenges that all of you are aware of with income inequality and the like. They benefit small businesses and communities because you know that when those who are impoverished are able to climb the income ladder, have extra income, that spend is directly into small businesses, into smaller retailers that cater to them, and it really does lift the quality of life in all communities. So we've talked this year certainly about access to health care. We've talked about literacy and financial education, and the banking committee, the gentleman from the San Fernando Valley, and now we have an earned income tax credit where we can actually have the spend to make sure that those dollars get to those who need it most and to the economies that are suffering the most. So this is tax justice. This is a tax credit that we can all embrace, that every community in the state of California will feel, every district will. We passed a bunch of tax credits last year. Some of it didn't spread across the state. This is a universal tax justice credit, and I thank the gentleman for bringing it forward, and the gentlelady from San Diego for her strong advocacy on this measure. Thank you, Mr. Speaker.
Thank you, Ms. Ridley Thomas. Ms. Olson, you are recognized.
Thank you, Mr. Speaker and members. I too rise in support of SB 80 and want to compliment and thank many members on this floor who have worked very hard to see this EITC proposal come to fruition. I will say all across the United States, EITC programs, both at the state level and federal level, have shown success, and it is a positive thing that we are encouraging people to move into the workforce and out of poverty. But I would be remiss if I didn't also point out that the way this EITC is structured at giving an average of $400 per family is not going to move anyone out of poverty. And that's what we have to continue to address. The EITC program is not going to combat the widespread poverty that California families are dealing with. We have the highest poverty rates in the nation. I know that's something that we're all concerned about, but it is really important that we not just sit here and say, great, we've passed this EITC program, we're going to give families $400 a month for working, but that we come back together to continue to work as Republicans and Democrats and address the true causes of poverty. The best way to bring families out of poverty and into greater opportunities, and I'm speaking from experience of my own father, is through a good job and a great education. And those are the two policies that this legislature has a lot of work to do on. So while I'm supportive of this effort, and I do compliment the people who worked very hard on bringing this to fruition today, it is so important that we recognize that this is a very small, teeny little step. And what we really need to do, if we care about helping families move out of poverty and into middle income and higher wage families, we have got to work together to address the challenges in this state that are preventing new jobs from being created, good paying jobs, and the challenges in this state that are keeping kids away from a quality education in far too many neighborhoods in California. But with that, I do urge an aye vote on this bill today.
Thank you. Ms. Olson. Mr. Thurman, you're recognized.
Thank you, Mr. Speaker. Members, I rise in support of SB 80. It was an honor to join the gentleman from Santa Cruz as one of his co-authors on this measure. I simply just want to say that I think it's time for California to be the leader and to join 24 other states that have a state earned income tax credit program. And yes, it's true that this by itself will not lift all families out of poverty, but for some families it will be more than $400. For those, it may be as much as $2,600. And yes, this should be a launch point for us to continue to do more work to help our families to get out of poverty by creating strong job training programs, yes, improving our education system, and making sure that all Californians can earn a decent wage and a living wage. I urge support on this measure.
Thank you, Mr. Thurman. All debate having ceased on this item, Dr. Weber, you may close.
Yes, Mr. Speaker and members, I am so pleased that the bipartisan support for SB 80 is apparent in the conversation, that we all are in support of EITC. We recognize the challenge of fighting poverty, not only in terms of an earned income tax credit, but obviously in issues of minimum wage and workers' rights and a host of other things that really talk about good quality jobs and compensation adequately for those jobs. This is only the beginning step, and it's important that we recognize that this is a part of our anti-poverty program here in the Assembly that the Democrats have put forward over the years to try to push the agenda of anti-poverty activities, and has been joined by many of our colleagues to do so. Our Speaker often says as a basic philosophy that no one should work in California and live in poverty. No one should work full-time and still live in poverty. And that's a value system that we have to adhere to, and this here bill incentivizes work. It incentivizes work, the fact that if you work and you work hard in California, you should be able to live a decent life and you should not live in poverty. SB 80, I respectfully ask for your aye vote.
Thank you, Dr. Weber. With that, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll. Tally the vote. Ayes 74, noes 1. Measure passes. We are moving to Senate Bill 81, SB 81. The clerk will read.
Senate Bill 81 by the Committee on Budget and Fiscal Review, an act relating to post-secondary education, making appropriation therefore to take effect immediately, bill related to the budget.
Dr. Weber, you may again open.
Yes, Mr. Speaker and members, again, I rise for SB 81, asking for your support. This is the higher education trailer bill. It improves the middle-class scholarship by imposing caps on assets similar to the Cal Grant program, a 4-year time limit, and an annually adjusted income and asset limit with inflation. It also delays the Cal Grant reduction for students that attend private colleges. It delays it for 2 years so that those students will continue to receive $9,084 annually towards their education. This bill also increases the number of competitive Cal Grants by 3,250 for a total of 25,750 competitive Cal Grants annually. And it combines $48 million to continue the Career Tech Educational Pathway programs for an additional year. I respectfully ask for your aye vote for SB 81.
I'm sorry. Ms. Kim, you are recognized.
Thank you, Speaker and members. This legislation is far from perfect, but it does include several Republican ideas, and for that reason, I rise in support of SB 81. This bill honors our veterans by ensuring that they will not have to pay out-of-state tuition, and it postpones the reduction of maximum Cal Grant awards. So, as we all agree, higher education is key to workforce development and a strong economy, and I urge your aye vote on this bill.
Thank you, Ms. Kim. Sorry, Mr. Mathis, you are recognized.
Members, I rise in support of SB 81 because the GI Bill does not cover the cost of non-residential student fees. This measure would greatly reduce the cost of higher education for veterans studying in California. I urge an aye vote.
Thank you, Mr. Mathis. All debate having ceased, Dr. Weber, you may close.
Yes, Mr. Speaker, I respectfully ask for an aye vote for SB 81.
With that, the clerk will open the roll. All members vote who desire to vote. 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 The clerk will close the roll. Tally the vote, ayes 78, no 0. Measure passes. All right, members, we are moving to Senate Bill 84. Senate Bill 84. The clerk will read.
Senate Bill 84 by the Committee on Budget and Fiscal Review, an act relating to state government, making appropriation therefore to take effect immediately, bill related to the budget.
Dr. Weber, you may open.
Yes, Mr. Speaker and members, I rise again for SB 84, which is a general government trailer bill that contains a mix of items related to state administration, general government, and local government. One, it expands the brace and bolt program from 4 dwelling units to 10 dwelling units or less in order to qualify for the residential mitigation grant program to ensure that vulnerable buildings are able to make basic seismic improvement. It also provides temporary housing assistance and makes the Office of Migrant Services housing centers available for rent by persons or families rendered homeless or at risk of being homeless as a result of the drought. It establishes a statewide director of immigrant integration to serve as the lead for planning and coordination of immigrant services and policies in California. SB 84 requires the Department of Finance to convene a working group to evaluate election-related mandates in the state. It also includes a plan to bridge existing gaps in California's ability to respond to catastrophic rail accidents involving hazardous waste. I respectfully ask for your aye vote for SB 84.
Seeing no discussion or debate on this item, the clerk will open the roll. All members vote who desire to vote. 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 Clerk will close the roll, tally the vote. Ayes 52, noes 24. Measure passes.